So hello everyone and good evening. Thank you all for joining us for our LIVERight webinar session of 2024. My name is Anisha and I will be the moderator and host for today's session. So the Canadian Liver Foundation office is located on the traditional territories of the Anishinaabe, Haudenosaunee, Mississaugas of the Credit First Nation territories. We acknowledge and extend our gratitude and respect to all First Nations, Inuit, and Métis people for their valuable contributions. Non-Indigenous people have an important role as we work towards reconciliation, and the more we take action and speak up against solidarity with Indigenous peoples, the more we can create lasting change for future generations. So the CLF has rebranded our webinars to the new LIVERight brand, encompassing more of our support and education services. So if you've attended any of our previous webinar sessions, you may remember those under our Living with Liver Disease brand. So even with this new name, our educational services have been around for more than 25 years and continue to serve as a supportive educational tool for both patients and caregivers, as well as people looking to learn more about liver health. This program provides opportunities to increase community-based learning about liver disease and the importance of liver health in the hopes to reduce the incidence and impact of liver disease through prevention, early diagnosis, treatment, and care without geographical barriers. Today's speakers are a specialist and a patient speaker, and we sometimes include allied health professionals and other subject matter experts as well. So today's session will address alcohol and liver disease with some updates and focuses on some common myths around drinking alcohol and liver disease. We're joined by our speakers, Dr. Eric Yoshida from the Vancouver General Hospital and our patient speaker, Samantha Harasumchik. We have both our speakers to complete this talk prior to moving forward to a question and answer portion. So please feel free to use the chat feature at the bottom of the Zoom screen to ask your questions during the presentation, but please note that questions will be answered following the speakers' presentations. Today's session will also be recorded and available on the Canadian Liver Foundation's Resource Hub, on our website, as well as on our YouTube channel and Facebook page in the coming days. So for those of you who may not be familiar, the Canadian Liver Foundation was established in 1969 and was the first organization in the world to help create initiatives for people living with liver disease. The CLF is committed to promoting liver health and improving the prevention, diagnosis, and treatment of liver disease through our 4 core pillars of research, education, patient support, and advocacy. At this time, I would like to welcome our first speaker, Dr. Eric. He is a liver specialist at Vancouver General Hospital, as well as a researcher and professor. He focuses on many areas of liver health and liver disease, and today will be providing us some updated information on liver disease and alcohol consumption. Dr. Yoshida, over to you.
Great, thank you, Anisha. That was a pretty old slide because, as most of you can see, there's a lot of wrinkles now, and it's like the hair is white. So, but thank you. That's a good picture. In terms of liver disease, I don't have any specific PowerPoint slides, and Anisha was kind enough to produce some. But you know, alcohol is quite common in Canadian society. It's the Canadian Center for Substance Abuse has reported that 80% of all Canadians consume alcohol, and yet alcohol is responsible for many deaths from all causes. In 2014, the Canadian Center for Substance Abuse reported that 15,000 Canadians died every year attributable to alcohol. That has since been upgraded, I believe, to 18,000. I saw that in a preamble of one of their publications. The previous guidelines, which Anisha has on the slide, was that men could drink 15 drinks per week and women could have 10 drinks per week. And we now know that that actually is not true, and actually that's now considered dangerous drinking. The new Canadian guidelines on alcohol is that the only safe amount to drink is actually 2 drinks per week. Anything more than 6 is considered putting people at risk. And it's important to appreciate that, yes, alcohol is a leading cause of liver disease, but alcohol is also is a risk factor, a known risk factor for cancer, all kinds of cancer, especially clearly cancer of the liver, but also cancer of the head and neck, cancer of the breast in women, cancer of the esophagus, cancer of the stomach, and colon cancer, all of which are gastroenterology, and I'm a gastroenterologist. Well, not breast cancer and head and neck cancer, but we see the other kinds of cancer. Clearly, alcohol can intoxicate people. It's a major cause for addiction. It's a major cause for depression. It's a major cause of trauma, and my hospital is a trauma center. Basically, alcohol can kill a lot of people, and it does so every year. In terms of liver disease, it's not really true that only alcoholics will get liver damage from alcohol. Non-alcoholic fatty liver disease, which is now called metabolic associated liver disease, which includes alcohol, but non-alcoholic fatty liver disease, that affects about 20 to 30% of the Canadian population. Nobody has actually done any studies in Canada about the amount of liver disease from alcohol, but worldwide, it's been reported and suggested that the number of world patients across the world with alcoholic liver disease is actually equal to the number of non-alcoholic fatty liver disease. And considering that even moderate alcohol drinking can result in fat deposition in the liver, depending on how we define liver disease from alcohol, I think that more people get some degree of liver disease, like fatty liver disease, if not true cirrhosis and liver failure and liver cancer. So I think that when we talk about cirrhosis and liver failure and liver cancer, we are only looking at the tip of the iceberg. I don't know if it's also another myth that if you don't binge drink, you'll never get liver damage from alcohol. Well, that's actually not true. I mean, as part of the liver transplant program at Vancouver General Hospital, we have people who were drinking what used to be the maximum amount that was considered safe in the old guidelines. And they have cirrhosis, they have chronic liver failure, and they need a transplant. So not binging is good, but if you drink regularly, you may still be at risk for liver disease. Liver disease is often reversible if you stop drinking. Certainly the fatty liver disease components are easily reversible. Even scarring of the liver that's not quite end-stage cirrhosis can be reversible. For patients who have cirrhosis and liver failure and they were drinking heavily, it's not uncommon to see that after 6 to 12 months of complete abstinence, their status changes from needing an urgent liver transplant to not needing a liver transplant at all. But they will still have cirrhosis and still be at risk of liver cancer. But at least the functional aspect of the liver is reversible if they stop drinking and are abstinent. Cirrhosis is only caused by too much alcohol. Well, that's a tough question, largely because cirrhosis can be caused by many liver diseases, including non-alcoholic fatty liver disease, hepatitis C, hepatitis Z, autoimmune liver disease. So cirrhosis can be caused by a lot of diseases, but a lot of the patients with those components, those kinds of liver diseases, they also consume alcohol. Maybe they don't consume a lot, but I would think that it may be a contributing factor. And somebody in the audience might go, well, you just said there's non-alcoholic fatty liver disease, and then there's alcoholic fatty liver disease. How could somebody have both? Well, if you have all the risk factors for metabolic syndrome, like too much carbohydrate, you're sedentary, and you're obese, and you have diabetes, which is another part of metabolic syndrome, and you drink moderately, I think it's safe to say that there was a component from both non-alcoholic fatty liver disease, metabolic causes, and also from alcohol. So it's not really true that if you don't drink too much alcohol, you're not going to get cirrhosis, because depending on your background, you still can. If I have a healthy diet, drinking won't harm my liver. Back when I was a medical student in the 80s, and certainly back in the 70s, it was often believed that cirrhosis from alcohol was actually caused from malnutrition. And if patients had a healthy diet and consumed enough calories, they wouldn't get cirrhosis. Well, to be honest with you, you look at technology from the 1970s and 1980s, and it was pretty primitive, even though at the time we thought it was wonderful. Well, just as technology has given us iPhones and cars that may be able to self-drive in the future, the study of liver disease and the study of medicine has advanced a lot since the 70s, 80s, and 80s. And I can tell you that if you drink if you drink alcohol, and it can be moderate to heavy, a healthy diet it might be protective, but it's not going to prevent the alcohol from not harming your liver. So the key is have a healthy diet, but don't drink much alcohol. In fact, I would prefer that people don't drink alcohol. If you don't have alcohol-related liver disease, I can still have a drink sometimes. Okay, that's actually a myth. If you have any kind of liver disease, like, why would you want to consume something that is itself an independent risk factor for liver disease? I mean, that kind of doesn't make any sense to me. It's kind of like thinking, well, I have high cholesterol, but I'm on cholesterol pills, but because I'm on cholesterol pills, I can still eat as much deep fried food and French fries as I want. I mean, that simply doesn't make any sense. It's actually counterintuitive. I think you have a non-alcoholic liver disease, you really should not be drinking anything, because you might, you're giving yourself a liver toxin, and you already have an independent liver disease.
All right. Thank you so much, Dr. Yoshida, for busting some of those myths that we've had. I'd like to turn it over to Samantha now. So Samantha is a 30-year-old woman who was diagnosed with cirrhosis in May of 2023. She has been sober since November of 2021. She currently lives with her fiance, her cousin, and all of their pets, and her hobbies include crocheting, hiking, fishing, and hunting, or just about anything outdoors. She loves to spend time with her niece and nephew, as well as chat with her friends, and her fiance are hoping to start a family of their own in the near future. Samantha, over to you.
Hi, everybody. Thank you for tuning in. So my name is Samantha Harris-Sumchuk. I am 30 years old, and last spring I was diagnosed with alcohol-induced cirrhosis. I'm currently staged at stage 1, F4 compensated cirrhosis. I've been sober for 2 years, 3 months, and 11 days. And to say that this diagnosis came as a shock to my family and myself is a bit of an understatement, especially after already being sober for quite some time. So I started heavily drinking in my early 20s. At first, I wasn't drinking any more than my friends or my partner was. We were young, and partying together was what we did. It's what everybody did. I was drinking what I considered a normal amount of alcohol on a regular basis. I never once considered myself an alcoholic or someone that had a drinking problem, and I never once thought that about any of my friends. At the time, in my mind, alcoholics were only people who couldn't control themselves, were bums, were too far gone, didn't want to be helped, probably had drug problems, thinking along those lines. I thought that because I was only drinking with other people, partying with my friends, and binge drinking on the weekends, that there was no way I could be an alcoholic. So throughout my early to mid 20s, I drank a lot. Eventually, I started drinking even when my friends or my partner didn't want to drink. I started drinking by myself. I started drinking in the mornings on days that I could get away with it. Over time, I was drinking more and more and getting better and better at hiding it, or so I liked to think. The truth is that early on, I might have been good at hiding it, but over time, my friends and family knew. As years went on, I started to drink more and more and pulled further and further away from the people that I loved. So throughout these years, I really struggled with my alcoholism. It was during this time that I considered myself as a functioning alcoholic, I suppose. I worked, I paid my bills, I attended bare minimum family events. I met my partner of over 6 years now, well in the deepest parts of my drinking. And now we're engaged and trying to start a family. For the longest time, maintaining a life while simultaneously working to maintain a buzz was working for me. Up until it wasn't. So in 2021, it was a pretty eventful year for me. This was the year that I really felt my drinking catch up with me. I was drinking to a point that it was difficult to maintain my job. It was the peak of the pandemic. I worked with the public. I was really stressed. My job itself was stressful. So I got a doctor's note to take some time off of work. And during that time, I thought it would be best to move out of the home I shared with my partner and move into a family member's house. So this is one of the first times that I had this gnawing feeling in my mind, kind of like a guilt about my drinking. I knew that I was taking it too far. Now that I had moved out of my home with my partner and I didn't have the interruption of work, my drinking got even worse. So I've had these thoughts plenty of times over the years while I was drinking, but this time was different. They were really, really sticking, and I couldn't shake the feeling that I was on the start of a downward spiral that I didn't know how I was going to get out of. A few months went by and I didn't think I could do it anymore. So one day I got into a huge fight with the family member's house that I'd been staying at, and I left. I drove home to my partner. He was happy to have me home safe and sound. But throughout that time, about 6 months had passed, and I was no longer employed, and I was just collecting EI. So due to the pandemic benefits, I could just continue to coast and drink. My partner still worked and was oftentimes working out of town. And it was actually during one of these trips out of town for work that I admitted myself to the hospital. So he left town for work, and everything was normal. I hadn't been feeling well for a few weeks, but nothing seemed to be too concerning. What I didn't tell anyone was that I started puking up blood in the mornings. Not a lot, but enough that I could see it when I was brushing my teeth. I just continued on with my life, which at this point was pretty much just me drinking and sitting around my house. On one particular day, I wasn't feeling well. I was run down, tired. I noticed that my skin seemed to have a little bit of a yellow tone to it. In the back of my head, my thoughts instantly started racing like, oh my God, is this jaundice? Jaundice is the liver disease. Did my drinking do this? Is this it? Has my drinking finally caught up with me? So as I walked into the downtown clinic, I had these thoughts racing through my head. I waited my turn at the clinic and the doctor finally saw me. He immediately looked at me and said I was jaundiced. And he asked if I drank. And I said yes. And he asked how much. And that was the very first time I had ever been honest with any medical professional about my level of drinking. I told him I was drinking about 15 to 30 ounces per day, give or take. And I had been drinking that way for years. Well, a few years. He was definitely shocked by the amount that I said. And he wanted to get blood work done immediately. But after he thought about it a little bit, he said it was best that I just check myself into Emerge right away. So that afternoon, I went home, packed a bag, and the following morning, I had my cousin bring me into the emergency department. So my time at the hospital was difficult to remember. I was there about 9 days. By the time I was seen by doctors when I first got there, I was almost fully sober. I had started to show my mild withdrawal symptoms, and the doctors were very concerned that I was going to go home and drink if they were to release me. They were concerned that I would go home by myself as my partner was out of town, and I didn't really spend time with anyone anymore. I remembered asking at one point, as I'm sitting there looking yellow, if this was something that I could fix and just take a hot bath and maybe drink a tea and go home and relax. The doctors looked at me like I was crazy, rightfully so, and they admitted me right then and there. The next morning, there was an opening in the addictions medicine unit, the AMU, in the hospital. I was very fortunate to have a program opening for the time that I was in the hospital. Oftentimes, medical intervention is necessary when someone is going through the withdrawal process from an addictive substance, and that was the case for me. So I stayed in the AMU, as I said, for 9 days. I went through all kinds of tests, got poked and prodded. I spoke with social workers and a counselor. I had nightmares and many tears. It was the first time in years I'd gone that long without drinking any alcohol. During my stay, I learned a lot about myself. The biggest lesson I learned was that I took my drinking way too far, and now my body's paying the price. While I was getting carted around the hospital from test to test, I got a sneak at some of my medical paperwork, and I couldn't make much sense of it, but I happened to see the scary words alcoholic hepatitis. And that was it. That was the only information I had been able to figure out or that I was given during my entire hospital stay. I had asked the doctors who came in and the nurses that saw me what I was diagnosed with or what the results of the tests were that I was being carted around to have done, but nobody seemed to give me an answer. It didn't matter much to me. I was just focused on feeling better, navigating my life while sober after I got out of the addictions medicine unit. So my partner came home early from working out of town so he could be home with me when I got discharged. The day that I was discharged, again, I was not told much. My discharge paperwork didn't divulge much information. I was told several times to follow up with my family doctor, who was about an hour away from where I lived. After I got out of the hospital, I was just happy and thankful to be alive and feeling better, happy to be home with my partner, who had been nothing but supportive and loving throughout our entire relationship. And I felt amazing. For the first time in years, I wasn't drinking. I started consulting with a dietitian right away because I basically had to reteach myself how to cook for myself, how to feed myself, all of those things. It had been years since I'd done that. So I started going for long walks on a daily basis, helping me develop a routine. I started caring for myself in ways that I hadn't bothered to do in years. Getting sober and choosing to stay sober is by far one of the greatest decisions of my life. Sure, my health might have indicated to me that I should get checked out initially, but it was and still is to this day up to me and me alone to stay sober and live my life in the best ways possible. My relationships started to heal and grow once again. I had reconnected with my two closest best friends and my cousin. I started to speak to and see some family more. My relationship with my partner has never been stronger. I started to feel better about myself as time passed, and I looked forward to what the future held. I took on many new adventures head first, and I even moved to the edge of Newfoundland for 6 months just for the excitement of it all. So fast forward to early spring of 2023. My partner and I are looking to finally settle down. We've been talking about starting a family of our own for some time, but he agreed that it would be best to talk to my family doctor and see what she says about my overall health and well-being. I hadn't really seen a doctor since I got out of the hospital from when I got sober. It had been about a year and a half into my sobriety at this point. I was just figuring that if I don't drink, and everything will be okay. If I don't drink, I won't become jaundiced. I won't need to stay in the hospital. If I don't drink, my health can't get any worse. Or so that's what I thought. That spring, so last spring, I called my doctor and I set up an appointment. It was a few weeks wait to get in to see her. While I was waiting, I had an appointment to get my wisdom teeth removed. Simple procedure at my dentist. My dentist prescribed me ibuprofen and Tylenol for pain management. 2 days into taking this medication very sparingly, something was wrong. I woke up in the middle of the night and I felt faint, like I was going to pass out. I started puking blood all over my bedroom and I had to be taken to the emergency room. I had some blood transfusions, and we had finally found out that my drinking had caused my stomach lining to just forever be weak. And I had an ulcer that was there for a long time, and the medication I was taking from my wisdom teeth perforated the ulcer. And I was bleeding a lot because of the ulcer. So, similar to my hospital stay when I got sober, I wasn't really told all that much. I was told that I was bleeding a little bit from an ulcer, but that was about it. So, I stayed here for a few days in the hospital then, but the doctor wasn't exactly forthcoming with information. He gave me discharge papers, told me I had a stomach ulcer, and that was it. So I waited for the follow-up from that hospital stay with my family doctor, and I booked an appointment in with her. It was originally just supposed to be a checkup to get an overall health and well-being before my partner and I started to get pregnant. But since the stomach ulcer issue, we were going to go over all of my medical results. I wasn't expecting to hear any bad news when I had went in. I'd been sober for over 1.5 years at this point, lived a fairly active lifestyle, ate fairly healthy. I went to my appointment. I walked in the room and sat down, and she told me I have cirrhosis. And I was stunned. The idea of being diagnosed with cirrhosis instantly made me want to throw up. I had no idea how to respond or what to do. I hadn't given cirrhosis or any type of long-lasting, permanent liver disease any thought. So that's obviously when my fear set in. It's a lot of unknowns. My mind began bouncing around all over the place as I left her office. I called my cousin that I lived with, and I kind of just blurted it out to her. I didn't have much more to tell her because I didn't know much more information. My family doctor wasn't equipped to give me much more information. She wasn't prepared to discuss specifics of cirrhosis with a 29-year-old female. She didn't even really know how to approach it. She's not a hepatologist and she's not a gastroenterologist. She was just overwhelmed and started setting up referrals and blood work and ultrasounds and doing her due diligence the best she could. I was told that I was going to get more blood work, wait for another call for an ultrasound, wait for a letter in the mail for an MRI, wait for a phone call or a letter from the vascular clinic in the city. I was also waiting for an appointment with the gastroenterologist because the city nearest to me doesn't have a hepatologist. It was mostly just a lot of waiting, which is kind of a scary place to be left in after such a scary diagnosis. So obviously I came home and immediately Googled it and started reading as much information as I could from trusted sources. I looked up support groups in my area and I found there's nothing in my area. I live in a small town in Northern Ontario. There's not a lot of resources. I found some fantastic support groups on Reddit that allowed me to read so many other people's stories, so many stories like my own, people not thinking that they're drinking or people not thinking that their drinking did not have a long-term hold on their body, only to find out years later that they have some form of liver disease. I joined a few groups, including some sobriety groups. There was a lot of overlapping members between the sobriety groups and the cirrhosis groups I had joined, much like myself. So I started to read stories about people close to my age, very similar stories like mine, heavily drinking into their mid to late 20s, thinking it was all without repercussions. And then in their early to mid 30s, being diagnosed with something as terrifying as cirrhosis. So it really just exemplifies how partying in your early adult years is glorified and it's what's expected of you. But nobody wants to talk about the health repercussions that you face sometimes shortly afterwards. So as time passed after my diagnosis, I began to educate myself more and more. I learned about cirrhosis and that how it is a very individualized disease. Each person's case is different. Some people catch their disease early on. Some people have more damage and scarring upon diagnosis, so they're bumped up on the transplant list. It really depends on a whole host of factors. People respond differently to medications, different foods, different routines. A lot of different things come into play. One thing that does seem to be a common theme amongst people that I speak to about my cirrhosis is surprise. Even other medical professionals seem to be taken back by how young I am to be diagnosed, and they don't really know how to respond appropriately. So a perfect example of this is about a month after my diagnosis in June of last year, I went to the optometrist, just my local eye doctor. I was due for a checkup. When he brought me into his office, he asked me if I had any health conditions that he should know about. I wasn't really too sure if he should know about my cirrhosis, but I just told him anyways. I was freshly diagnosed and it was constantly on my mind. I said, well, I was recently diagnosed with cirrhosis. I'm not sure if that's something that you need to know for eyes, but there you go. He responded in what I think was supposed to be a joking manner by saying, oh, what? Are you a booze hound? And I was kind of stunned. I didn't really know what to say. I said, well, I guess I used to be. And throughout the rest of the appointment, he grilled me about my alcohol consumption in the past, how much I drank exactly, what I drank, when did I stop drinking. He asked me questions about his own alcohol consumption and compared my answers to his own drinking. The entire appointment, I was kind of speechless. the most shocking part of the whole thing was how he assured me that his liver health was fine. He said his doctor didn't say he could drink whatever amount he wanted, but his liver is in great condition. I wasn't really sure what to say at the end of the appointment other than I'm glad to hear that your liver health is good. I've had a few instances where a medical professional didn't quite know how to respond in an appropriate manner to my condition, but that by far took the cake. I have also had a doctor say, there's no way you could have done this to yourself with alcohol. You're far too young, which is also just flat out incorrect. You can absolutely do damage to your liver by drinking excessively, even if you are young. And I'm living proof of just that. Another common theme amongst women in particular with cirrhosis or liver damage from alcohol seems to be an irregular menstrual cycle, myself included. I've struggled with this throughout most of my adult life, but it was never a big issue until my partner and I wanted to try to start a family. This was a topic that I had a hard time finding a lot of information about online. So after I failed to find more information on Google, I went to Reddit. After going over past posts, I actually found a woman in her mid-30s who was pregnant with cirrhosis. She was just finishing up her first trimester. I immediately showed my partner because I was really excited, and I sent her a message asking her for more information. She took the time to send back such a kind and informative message explaining the struggles she had had to get to this point and the struggles that laid ahead of her, according to her doctors. And it just brought joy and some hope to our hearts that maybe we'll get there one day too. There are a whole list of factors at play when pregnant with cirrhosis, but it still gave us a little bit of hope. But waiting and confusion also seemed to be the biggest common theme amongst people who were freshly diagnosed. While I was sitting around waiting for tests and appointments, I once again took to Reddit to see if waiting was a common theme experienced by other people in this situation, and it is. It's very scary. There's a lot of unknown. You're sent to a whole list of doctors and appointments, and you think you've gotten to the bottom of it, and one test shows one result, another test shows another. It's very hard. It's very overwhelming. The best thing to do is try to be patient and educate yourself. Don't scare yourself with internet research. But I taught myself how to read my lab results. I would ask for the results from my doctors, and I would read that. I would have copies of my blood work emailed to me so I could follow along on my own health journey. And I felt like that really allowed me to take some control back in a situation that I didn't really have much control over. A couple of months after being diagnosed, I really wanted to speak to someone that was in a similar situation to mine, and I thought I might reach out to the Canadian Liver Foundation. I went to their website, found an email, and if I remember correctly, the response I got was very kind and very heartfelt. I don't think it was Anisha that responded to me. It was somebody else, but I connected with Anisha afterwards. She connected me to one of my first liver pen pals, as I like to call her. I have two now. It was just another woman who had reached out to the Liver Foundation like I had, hoping to make a connection, looking for somebody to talk to. And we've been emailing back and forth now for 5 or 6 months, just talking about our medical appointments and asking how each other's families are. And it's a nice way to casually keep up with someone that's just in a similar situation to ours. Since my diagnosis and all of the learning I've done about this disease, I truly believe I'm an advocate for being aware of just how much harm consuming alcohol has on your body. It wasn't a shock to me when Health Canada amended its recommended drink amount per week and declared that no amount of alcohol is safe, but the 2 drink per week recommendation. People need to be aware of what is happening to their bodies when they consume alcohol and take preventative action to ensure they don't end up with liver disease. Personally, I think the advertisement of alcohol should be heavily restricted, much like it is with tobacco or marijuana advertisements. Companies and industries shouldn't be able to glorify what is poisoning you as fun and a good time. There should be no misunderstandings. Any amount of alcohol consumption is unsafe for you and can potentially do long-lasting damage to your body. You may not see it right away, but the damage can take a toll over time. Moving forward, I think I have a better handle on my disease now. Throughout my day-to-day life, I'm fairly asymptomatic. I'm very lucky in that sense. I know what works for me in my diet. I've been taking my medications regularly, and that has helped me with my overall well-being. I've completed a cognitive-based therapy program that helped me navigate the scary emotions that you face when you're first diagnosed, and I communicate with my doctor on a regular basis. What I need, she helps out in any way she can. Right now, my partner and I are still trying to reach our goal of having a family of our own. It's looking like we'll get there one day, but we just might have to try out a few different options until something sticks. I continue to receive love and support from my friends and my family, and I'm thankful for that every day. I've learned to find joy in every day and live my life to the fullest that I possibly can. If I had to choose one piece of advice to pass on, I would say don't wait. Don't wait to talk about your drinking. Don't wait to confront how much you drink or even why you drink. Don't wait to book an appointment if something feels off. Don't wait to heal that relationship around you. Your support network will get you through anything that you need when you think you won't get through it. Just don't wait for anything. It's not worth it. Thank you, guys.
Samantha, thank you so much for that very, very touching story. That was incredible, and hopefully we'll be able to help many people. And I wanted to thank Dr. Yoshida as well for his invaluable information in giving people a little bit more clarity around alcohol and drinking, alcohol and liver. So I'd like to turn it over to our chat. If there are any questions, I'd like to invite Dr. Yoshida and Samantha both to come off mute. And we can have a little Q&A session with anyone that has some questions. We've also gotten some questions beforehand as well. So if you don't have any questions at the moment, not to worry, you are welcome to put them in the chat whenever you. I'm just going to stop sharing so that everyone can see our speakers. So I know that we've had a few questions, like I mentioned, from people previously. So my first question is for Dr. Yoshida. A little bit in relation to Samantha's story. How can someone in early stage cirrhosis slow down their progress with the alcohol-related disease?
Well, I think that the first thing to do is talk to your family doctor. I realize that you have a problem, and get some counseling. Now, that sounds easy to do, but in actuality, it's actually quite difficult. There's a big stigma, as Samantha pointed out, and Samantha, I thank you for your courage. And I'm also going to say that this isn't Samantha's fault. This is society's fault. You know, there really is no education about, public education about alcohol. In British Columbia, and I hope the situation is different in the other 9 provinces and 3 territories, but I doubt it. In British Columbia, school children and high school kids, they actually get zero education about alcohol. They're taught all about smoking and lung cancer. They're taught about drugs and fentanyl, and they're taught about safe sex and HIV and things like that. But they're given no education about alcohol, and I don't really know why. You know, when you walk into a restaurant, you see all these signs from Budweiser and encouraging you to buy more alcohol. And when you have a bottle of beer in your hand, there is no safety label saying that this can be actually detrimental to your health. It can cause cancer. It can kill your liver. It can harm an unborn child. There is nothing. Like, nothing. Like, that's the society's fault. I mean, for the past 5 years, I've been on this one-man crusade to try and get more public awareness and get safety labels on alcohol products. And I have a good partner in the British Columbia government. We even got the city of Coquitlam to pass a resolution asking the federal government and the provincial government to do something. But it's been difficult. The alcohol industry is kind of like the gun industry in the United States. They're a difficult industry. They won't accept that it's an issue. So that's my take on things. And now I've forgotten what the question was, but Anita, what was the question again?
It was how someone with early stage cirrhosis
yes.
can kind of slow down their progression if they've got alcohol-related liver disease.
Well, I think that you really the person has to really stop drinking. Like, and there are counselors who can help, but really, you have to do what Samantha did. You have to realize that even though nobody taught you anything about this, and doctors aren't really giving you that much information, and Samantha, I'll say that optometrists are not medical doctors, ophthalmologists are, so, and I thought that was appalling, totally inappropriate comment, but I think the first thing to do is to get some professional help, because you know, there are lots of people, our liver transplant program sees lots of people who have tried to do it themselves, and it's almost impossible, in my opinion. So I hope that answers the question.
Yeah, I think that can be a helpful thing, is to really just stop drinking and maybe learn something from Samantha's story.
There are also medications like acamprosate and naltrexone that can actually help with the craving.
Certainly. A bit of a kind of related and kind of follow-up question that can be for both of you, but I'll start with Samantha. Maybe from your own experience, what have been some helpful ways to advocate with your family doctor or other doctors to help you get the care that you need?
I'm sorry, I couldn't hear that. My internet best.
Oh, I think you might be a little bit delayed.
Sorry.
That's okay. Internet issues happen. So the question is, what did you find helpful in advocating for yourself in getting the care that you need from the doctors that you're seeing? Can you?
I'm sorry.
Okay, no problem. I'll come back.
I can't hear anything. I can't hear anything. Sorry.
That might be an issue. You might want to just check your. Dr. Yoshida, maybe I'll turn it over to you while Samantha sorts herself out over there. Are there any tips that you can provide to patients on advocating for themselves if they, are going to their family doctor suspecting something, or maybe for those that don't have a family doctor, how they can continue to advocate for themselves to get the care that they need?
I think talking to the family doctor and being honest with the family doctor and expressing concern. The family doctor may not have a lot of knowledge. They may not have a lot of patients with this issue, largely because there are a lot of family doctors who spend their entire career without seeing anybody with cirrhosis. I mean, that depends on where you practice and what patients are in your practice. If you can't, I think the best thing to do is help yourself and try to find a counselor. And there are lots of counselors who you could look up on the internet. Well, and you used to look them up in the yellow pages, but in the telephone book, they don't have telephone books anymore. But that's probably what you can do. And if things are really not going well and you're really ill, going to the emergency room and being seen there, they can hook you up with people too.
Certainly. What do you recommend maybe for family doctors that might not have the knowledge? Should you be asking for a specialist? Are there other ways to navigate that?
I think that if a family doctor isn't comfortable with the topic and doesn't have that much knowledge, they can certainly refer, or they can certainly talk to some specialists in the field. But referral is usually what they do, at least in Vancouver.
Okay, that's good to know. My next question for you, Dr. Yoshida, is if someone has alcohol-related fatty liver disease, are non-alcoholic beverages such as non-alcoholic beer or wine okay to have?
They don't, again, they don't have alcohol in them if they're non-alcoholic. But keep in mind that fructose is often the sweetener of choice for the food industry, largely because it's inexpensive and it's kind of sweeter than sugar. But fructose actually is very good at accumulating in your liver as fat. So I think a 0-calorie beverage is good. Coffee is actually helpful for your liver. At least it's not harmful. And drink as much coffee as you want, kind of thing.
Okay, great. So maybe sticking to lower calorie options can be beneficial for people. Have we managed? Samantha, are you back online?
Can you hear me? I can hear you guys a bit better now if I shut my video off.
Okay, perfect. I will send the next question over to you then. Dr. Yoshida had already given a little bit of insight into dealing with doctors. I'm wondering from your perspective, what have been some helpful tips to dealing with family doctors, specialists, other medical professionals to get the care that you need and advocate for yourself?
Yes, absolutely. Nobody's going to advocate for you. Not a single person will advocate for you as much as you'd like to think somebody will. My family doctor, the multiple hospitals I've stayed in, the multiple clinics I've been to, you have to be your own advocate. Number one, you need to be your own advocate. If you can have a family member with you that is able to stay calm and communicate clearly and calmly with the medical professional, that's fantastic. Just having a second set of eyes and ears in the room and taking notes, writing down the questions you want to ask before the doctor comes in the room. Doctors are busy people. They're smart. They got a lot of people to attend to. There's a lot of sick people when you're in the hospital. So you don't want to tie up the doctor's time. So you just make it as efficient as possible. For me, anyways, I found having a notebook and a pen was just so helpful. It took away the stress of trying to remember everything the doctor or the nurse says. And then you have something back to refer to in case you forget or get overwhelmed. And advocating for yourself and taking notes are probably my biggest tips for sure.
Great, perfect. One more question for Dr. Yoshida, then I have a couple more for Samantha. This one is a little bit maybe more complicated. If someone has non-alcoholic fatty liver or alcoholic fatty liver disease, can they use a little bit of alcohol in cooking, and does it burn off enough to make it safe?
Well, the answer to that is actually easy. I think the alcohol evaporates when you're cooking, so there shouldn't be any alcohol residue in the meal that you're cooking. So I think it's probably safe.
Okay, great. I know that that's sometimes a bit of a gray area for certain people as to whether or not they should, and even if they kind of cook it off, whether or not that's still okay to have. Samantha, what has been the biggest thing to help you cope with your diagnosis?
Talking about it a lot, even when I can tell people don't want to hear me talk about it anymore. Just being open.
Oh. Samantha, I think you muted. There you go.
There you go. Sorry. Did you
That's okay.
hear anything I said?
It was a little bit choppy, so if you could give a little bit of context, yeah, that'd be great.
Can you repeat the question again?
Oh, you're a little bit a little bit hard to hear you. Maybe try leaving and rejoining. It might be an internet issue.
Okay, 1 second.
In the meantime, maybe Dr. Yoshida, you can provide some insights on maybe common mistakes people make when dealing with alcohol, regardless of liver disease, whether that's related to consumption or misconceptions?
Well, I think the commonest problem is lack of insight. And it's a difficult situation. I mean, alcohol itself, it can be very addictive, to be totally honest with you. Patients go into it with the best of intentions that they're never going to drink, but then circumstances happen, or they have one drink and old habits return. I think people who have alcoholic liver disease or alcohol-related issues, they really need full counseling, and it has to be overarching. I mean, a lot of times there are real reasons why people are drinking, and drinking is just an attempt at self-medication, and the root cause, you can tell them to stop drinking, but then if you don't deal with the root cause, whether it's anxiety, whether it's depression, whether it's bad living circumstances, that kind of thing, then it's ultimately going to be futile. Or they may trade one addiction to alcohol or addiction to some other substance that's just as bad, or if not worse, than alcohol.
Right. Yeah, definitely. I think sometimes the root causes of why people might choose to drink can definitely be harder to pinpoint. Samantha, how are we doing? Can you hear us? Can you see us?
I think I'm doing better.
Yes, much better. You sound much better. I think there might have been a little bit of a glitch earlier.
Okay, sorry about that.
Thank you again, Dr. Yoshida, for answering some of our questions. So Samantha, what has been the best thing to help you cope with your diagnosis? I think that was where we left off.
Coping, just talking about my diagnosis, talking about all my medical appointments, talking about the medication I take, just talking about it and not keeping it in. Reaching out to online support groups I found was really beneficial as well. I really liked it first, like websites like Reddit and stuff allow you to stay anonymous. So I enjoyed just reading other people's stories until I found the courage to start talking about my own, I guess.
Fantastic, thank you. And next question also for Samantha. What has motivated you most during your sobriety and cirrhosis journey?
Seeing how fast the kids in my life are growing and how much I missed, and staying sober for that.
That's fantastic. And to wrap up here, what is one piece of advice that you would give to others who are newly diagnosed with alcohol-related liver disease or cirrhosis?
It's terrifying. At first, it seems so terrifying and like the world is going to end and everything is so unfair, and you feel alone, and like the word cirrhosis or hepatitis or anything to do with the liver has such a stigma around it that nobody even wants to talk about it. And it's not as bad as it seems, and you're not alone. And no matter in what community you're in, if you got a cell phone or a laptop, there's always a group available online. There are groups that operate 24 hours a day, ones that operate on social media, not on social media, religious-based, non-religious-based. A group for everybody is available. So there's always somebody to reach out to. And I found that was a big comfort and support for me.
Amazing. Thank you both so much for all of your answers. I know that many, many people will find them helpful. So that concludes our LIVEright webinar session for today. I'd like to take this time to thank our speakers, Dr. Yoshida and Samantha, for their incredible presentations. And as I mentioned at the top of the session, This will be available on the CLF webpage, the CLF Resource Hub, Facebook page, and YouTube channel over the next few days. Keep an eye out for upcoming LIVERight sessions throughout the year. Our next session is on March 28th, which will focus on affordable nutrition. More information on these sessions will be available at the start of each month, so if you don't see anything posted yet or minimal information, please do check back in a couple days or weeks as we're likely finalizing some of those details. So before we conclude, I want to mention that there will be a post-session survey / evaluation sent to all of the people that registered shortly after this webinar for you to complete. We really appreciate when you're able to do that. Thank you all for attending today's session on alcohol and liver disease. And should you have any additional questions or comments, or simply want to stay up to date on everything liver health related, please connect with us via our social media channels or send us an email at clf@liver.ca. You can also find my contact information if you'd like to contact me directly. Once again, have a great evening.